Someone can lift heavy weights. Someone can walk briskly, look strong, look completely healthy, take no medications at all, and still be quietly losing one of the most important abilities a person can have, the ability to stay independent. Think about someone you know who looks powerful. Big muscles, strong handshake, no health complaints. And yet, if that same person trips on an uneven sidewalk, they can't catch themselves in time. If they misstep coming down a curb, their body doesn't react fast enough to recover. If they get injured, it takes them months to bounce back to where they were before. Strength alone doesn't tell the whole story. Appearance doesn't tell the whole story. Not being on medication doesn't tell the whole story either. Today, Dr. Evans is going to walk you through 5 essential points that most people completely overlook. 5 things that can quietly shape how many healthy, independent years you actually get to live. Not necessarily how long you live, how well you live. How much of your life you get to spend doing what you want, moving how you want, without needing help for basic things. Before we get into the 5 points, if this is the kind of content that matters to you, content about staying strong, staying steady, and staying independent as you age, hit that subscribe button right now. It helps more people like you find this channel, and it costs you nothing. Alright, let's get into it. Here's something we need to clear up first, because it changes how you'll hear everything else in this video. A lot of people believe that aging well means passing some kind of test. Stand on one leg for this many seconds, get up from the floor without using your hands. Squeeze this hard on a grip test. And if you fail, the belief is that you're somehow doomed, that your body is falling apart and there's nothing you can do about it. That belief is wrong, and it's actually harmful. Physical tests can give you useful information. They're not meaningless, but they have to be understood in context, the context of your body, your history, your life. Think about someone with arthritis in their hands. Their grip strength on a test might look weak, but that has nothing to do with how long they'll live or how healthy their heart is. It has to do with their joints. Think about someone with 2 knee replacements. Getting up off the floor might be difficult or even impossible for them in the way a test expects, not because their body is failing, but because of the hardware in their knees. Think about someone who injured a hip decades ago and has walked with a slightly different gait ever since. Or someone whose hearing has changed and now struggles with balance because their inner ear isn't giving their brain reliable signals. Or someone with a neurological condition that changes the way their legs move. And think about someone going through grief, or depression, or fear after a bad fall. Their walking speed can slow down, not because their muscles gave out, but because their mind and their emotions are carrying something heavy. None of these situations are a life sentence. None of them mean a person is destined for decline. A limitation in one area does not define someone's entire future. So, instead of judging your body or someone you love by a single test, a single moment, a single number, we're going to look at this differently. The 5 points coming up give you a much more complete picture of what aging well actually looks like. Not a pass-or-fail test. A full panel the way a doctor would look at multiple markers together instead of one number in isolation. Let's start with the first one, because it's probably the most misunderstood of all 5. Power and reaction speed. Most people think strength and power are the same thing. They're not. Strength is your ability to produce force, period. You can be strong and still be slow. You can push a heavy weight steadily, with control, over several seconds, and that's strength. Power is different. Power is your ability to use that force quickly, right when your body needs it most. Here's why this distinction matters more than almost anything else we'll talk about today. Think about the moments in real life where your body actually needs to protect you. You trip on a curb. You lose your balance stepping off a bus. You need to catch yourself before you fall. You're stepping up onto something uneven. You feel yourself tipping backward and you need to recover your footing in a split second. None of those moments give you time to slowly build up force the way you would lifting a heavy box. Those moments require speed. They require your muscles to fire fast. Right now, without warning, this is exactly why someone can have decent muscle strength and still be at serious risk of a fall. Their muscles can push, but they can't react. And here's the part that catches people off guard. The fast-twitch muscle fibers responsible for that quick reaction are exactly the ones that decline the most with age, especially when they're not being used. Slow, steady strength training alone doesn't fully protect them. If you never ask your body to move quickly, it gradually loses the ability to. The good news is that this capacity can be trained safely, gradually, and without doing anything extreme. This isn't about jumping onto boxes or sprinting up hills. It can be as simple as practicing a quick step forward or sideways while holding onto a sturdy countertop. It can be gentle, quick sit-to-stand movements from a stable chair. It can be practicing a fast reaction to catch your balance in a completely controlled, safe environment, ideally with guidance from a physical therapist or a qualified trainer who understands your specific situation. If you have pain, a history of falls, or any instability, please don't attempt fast or explosive movements on your own. This is exactly the kind of thing worth bringing to a doctor or physical therapist first, someone who can watch how you move and build a plan that fits your body specifically. Now, here's something interesting. Two people can be the exact same age, eat similar diets, and even have similar strength levels, and still recover from an illness, a fall, or a surgery in completely different ways. One bounces back in a few weeks. The other struggles for months and never quite gets back to where they were. Why? That's exactly what point number 2 is going to explain. Aging well doesn't mean never getting sick. It doesn't mean never getting injured, never having surgery, never going through a hard season. That's not realistic for anyone. The real marker, the one that actually matters, is how much of your physical and mental capacity you're able to get back after something knocks you down. An infection, a surgery, a fall, a period of bed rest, a hospital stay, even a stretch of high stress or grief. This is what we mean by your recovery reserve. Here's the pattern that catches so many people off guard. Small losses add up quietly. A week in bed after surgery, a month of low activity during an illness, a stretch of poor sleep and skipped meals during a hard emotional period. Individually, each of these seems minor, but stacked together, over the years, they can turn what should have been a 2-week recovery into months of dependence on other people for basic tasks. So, what actually protects your recovery reserve? Getting enough quality sleep, eating enough food overall, undereating during a hard time, is far more common than people realize, especially in older adults who lose their appetite during stress or illness. Getting an appropriate amount of protein, based on your individual needs and any guidance from your doctor or dietitian. Staying consistently active even in small ways rather than stopping completely. Returning to movement gradually after any setback instead of jumping back in too fast or staying still too long. And addressing the medical reasons behind a sudden drop in energy, because fatigue that comes on quickly is not something to brush off as just getting older. One thing we want to be clear about, supplements are not a shortcut here. Don't start taking iron vitamins or mineral supplements on your own without blood work and guidance from a healthcare provider. Some of these can actually cause harm if you don't need them, and the only way to know what your body actually needs is through proper testing. And here's something worth repeating. Fatigue, weakness, or a sudden loss of mobility should never be automatically written off as just aging, especially when it shows up quickly. Rapid changes deserve a conversation with a doctor. Aging is gradual. A sudden decline is a signal, not a life stage. Now, let's move to point number 3, and this one surprises almost everyone. Balance is not just about your legs. Balance depends on constant communication between multiple systems in your body working together. Your vision, your inner ear and hearing. The sensation in the bottom of your feet, your brain processing all of that information in real time, your joints, your muscles, and even your medications and blood pressure, which can affect how steady you feel from one moment to the next. This is why someone can have strong legs and still feel unstable, because one of these other systems isn't sending accurate information to the brain. Strong muscles can't compensate for a signal that never arrives. So, what are the warning signs worth paying attention to? Starting to bump into furniture? Is there feeling unsafe in the dark more than you used to? Losing your balance when turning quickly? Needing to look down at your feet constantly just to feel steady? Feeling dizzy when you stand up? Or noticing a sudden change in your hearing or the way you walk? If any of these symptoms are new, persistent, or come along with dizziness, weakness, fainting, or any neurological changes, that's a clear signal to get evaluated by a doctor. please don't wait on that. And one more thing worth saying clearly. Using a cane, a handrail, or any other mobility support is not defeat. It's not giving up. It can actually be the tool that lets you keep your freedom and your confidence, letting you keep doing the things you want to do safely instead of avoiding them out of fear. Now, point number 4. Functional mobility that respects your joints. Mobility doesn't mean performing one specific movement exactly the same way everyone else does. That standard doesn't make sense for real bodies with real histories. Someone with a joint replacement arthritis, a height difference between their limbs, an old injury, or any anatomical limitation may genuinely need a different strategy. And that's not a failure, that's just how their body works. So, instead of a pass-or-fail test, ask functional questions instead. Can you stand up from a chair with control, instead of dropping back down or launching yourself up? Can you get in and out of bed without struggling? Can you step up onto a curb safely? Can you bend down and come back up again? Do you have a safe strategy for getting up off the floor, using support when you need it? Can you carry everyday items, groceries, laundry, a grandchild without losing your balance? Using your hands for support doesn't automatically mean weakness. Sometimes it just means you're being smart and using the tools available to you. The goal here isn't to impress anyone with a perfect test performance. The goal is to preserve your options, your ability to move through daily life the way you want to. Training in this area has to respect pain, surgical history, and your individual limitations. And please, don't try new movements alone. If there's any risk of falling or injury, this is exactly the kind of thing a physical therapist can help. You build safely, step by step. Before we get into the final point, I need to ask something quick. If this video is giving you something useful, hit that like button. It genuinely helps this channel reach more people who need to hear this. And drop a comment letting me know which of these points hit closest to home for you so far. It helps me know what to cover more in future videos. Alright, let's talk about the 5th and final point, and it might be the one people think about the least. Longevity isn't built inside a gym alone. That might sound surprising coming from a health channel, but it's true, and it's something too many people overlook. Isolation, loss of purpose, grief, and a lack of routine can quietly reduce how much you move, how much you eat, how well you sleep, and how motivated you feel to take care of yourself at all. When someone loses a spouse, retires without a new sense of purpose, or simply stops seeing people regularly, their whole health picture can shift, not because their body suddenly changed, but because their reason to take care of it faded. So, what actually helps here? Activities that combine movement, connection, and meaning all at once tend to have the biggest impact. Walking with friends, dancing, being part of a community group, attending a church or a gathering that matters to you, tending a garden, learning an instrument, volunteering your time, cooking your own meals instead of skipping them, staying in regular contact with family. We're not saying faith or social activity are medical treatments, they're not, and we won't pretend otherwise. What they do offer is connection, routine, meaning, and motivation, and all of those things directly support the physical habits that keep you strong and steady. The best activity for you isn't necessarily the most intense one. It's the one you'll actually keep doing, the one that keeps your body moving and your mind engaged, week after week, for years. Now let's bring this all together. No one should look at a single movement, a single test, or a single bad day and decide they're either perfectly healthy or completely doomed. That's not how this works, and it never was. Here are the 5 points again, together, as one complete panel. Power and reaction speed, your ability to respond quickly, not just push hard. Recovery reserve, how much of yourself you get back after illness, injury, or a hard season. The invisible systems behind your balance, vision, hearing, sensation, and how well they're talking to your brain. Functional mobility adapted to your body, not a generic standard, but what actually works for you. And connection, purpose, and consistency, the part of health that has nothing to do with the gym at all. You don't need to be perfect in every single one of these areas. Nobody is. The most important thing is simply noticing changes, adapting to them, and acting before a small loss turns into real dependence. And if you've already been through an injury, or you've noticed yourself slowing down over the past year or two, I want you to hear this clearly. Being slower right now does not mean all your progress is gone. Recovering even part of what you've lost is a real, meaningful victory. It counts, it matters, and it's absolutely possible with the right approach. Here's a simple plan for the week ahead. Nothing complicated, just some honest observation. Notice how you react when you lose your balance slightly, even for a split second. Pay attention to how you feel after a more physically demanding day. Do you bounce back quickly, or does it take days to recover? Think about whether you've noticed any recent changes in your vision, your hearing, or the way you walk. Consider which everyday tasks have started to feel harder than they used to, and take stock of how many social or meaningful activities are actually part of your week right now. This isn't a diagnosis, and it's not meant to scare you. It's simply information that helps you notice patterns early while there's still plenty of time to act. That said, if you experience a sudden decline, repeated falls, intense pain, fainting, weakness on one side of your body, unusual shortness of breath, or any neurological changes, please don't wait it out. See a healthcare professional. Those signs deserve real attention, not guesswork from a video. Let's close this out. Aging well was never about proving you're still young. It was never about passing a test or matching someone else's standard. It's about preserving your freedom, your ability to adapt, your ability to keep showing up in your own life on your own terms. So, here's a question for you. Which of these 5 areas do you think deserves more attention in your life right now? Power and reaction, recovery, balance, functional mobility, or connection and purpose? Drop your answer in the comments. I read every single one, and I'd genuinely love to know where you're starting from. If this video gave you something worth thinking about, hit that like button before you go. And if you haven't already, subscribe so you don't miss what's coming next. And if you want to see exactly how this connects to the video that started this whole conversation, take a look at the one on your screen right now. It walks through the original test that inspired everything we just covered, and it'll give you even more context for applying these 5 points in your own life.